here to talk to the Honourable Vice Chancellor of Bangabandhu Sheikh Mujib University, Professor Dr. Muhammad 𝗕𝗏𝗄𝗏 Ahmed. And I welcome you to listen to the Honourable Vice Chancellor.
In our country, there was the movement for the autonomy of the medical colleges for a long period, and we didn't get after this autonomy after the independence of Bangladesh. After 27 years after our independence, that is in 1998, after 1971, our Honourable Prime Minister, Sheikh Hasina, daughter of our father of the nation, she has given us this medical university in 1998, 30th April. After the inception of this university, we have started this post-graduation in Bangladesh. All the postgraduate, MS, MD, MPhil, diploma, everything is going on in this university. We have about 104 courses and we have 57 departments. If anyone is not educated or have no post-graduation, he will not be the teacher, he will not be the specialist. You all know that even in our Upazila, there are 9 consultant posts in districts and other divisional hospitals we have consultant. This consultant is being post-graduated from this university, number 1. Number 2, during our liberation there was only 8 medical colleges. Now there are about 113 medical colleges. So the teachers of these medical colleges, and including about 12 to 15 institutes like NIO, NICDU, NIENT, mental health, or 𝗕𝗏𝗄𝗏 burn and plastic. In this way, NITOL, NICBD, there are a lot of institutes. We are also giving the consultant or the teachers to this institute from this university. So the medical education is going on. We have another facilities here, that this is the laboratory for the postgraduate students, and this laboratory is that not only the investigation facilities, our outpatient department. Every day about 8,000 to 9,000 patients are coming here. Why? They are getting the service, and the better service of the country. And even when our Honourable Prime Minister has inaugurated the Podda bridge, which is being built by our own money, with the courage of our Honourable Prime Minister, this bridge has been established, and the people from southern part of this country, they are coming in the morning, they are taking treatment and going to their own houses every day. So about 1,000 to 2,000 people are coming, much more after inauguration of our Podda bridge. So you see, even in metro rail, if anyone comes, the patient will come directly to this university from Mirpur, from Motijil. So another 1,000 patients will come here because of our.
So, Mr. Vice Chancellor, do you feel the pressure, having influxing of patients? So pressure in terms of managing a large number of patients every day.
Yes.
Do you feel?
Yes.
So what would be the better management?
So in this respect, I will I want to discuss about this, that as the influx of outpatient department as well as the operation and the patient admitting in my hospital, this is being increased than previous, as because the communication is very much developed. So in this respect, we are now thinking that according to the treatment of the patient doctor's ratio should be increased. So I have taken a decision that I will invite, or I will give the advertisement for recruitment of our teachers, and I will hope that they will come up, they will work as the specialized people, especially doctors, and they will be able to manage this influx.
That's good to know. But to get doctors on board as a teacher, what would be the assurance of the quality of the medical teachers?
Okay. In this respect,
yes,
there is the training of the
teacher. May I supplement one more point here? That is, almost every year there is a survey that 100 crores of taka is being drained from the medical sector to the outside. And there is a survey from India that the medical tourists going to India, out of the total number, 54.3% they are from Bangladesh. So having this scenario, it proves that patients are being discouraged mostly to take treatment in our country. So here, from this medical university, again, as I said, this is the central medical university of our country. So it is now from year to year to assure the people the quality of the medical teachers.
You should know that in 1998, the university was established.
Yeah.
After 23 years, that is in the last year, our Honourable Prime Minister had established another super specialized hospital. This super specialized hospital is, here we are performing the transplant, we are performing the Mother and Child Center, 𝗕𝗵𝗄𝗵𝗵 and Hepatology Center. We have established here the Trauma and Accident Center. Another one is the transplant of the liver and kidney. We have established the Stroke Center, Cardiac and Neuro Stroke Center, and also Mother and Child Center. In future, I am thinking that there will be the robotic surgery, there will be the we will establish the stem cell therapy, infertility, and also PET scan for cancer. These are the specialist presentation.
Is this a specialized, super specialized hospital?
Yes.
Of this structure? Is it backed by South Korea?
Yes, it was just we got the loan from
only the money.
Yes, loan from Exim Bank of South Korea.
Okay.
And we have already established this hospital, all types of patients in OPD and in IPD, that is indoor, it is going on.
But apart from the money, apart from the fund, do you expect or receive any specialized training programs?
Yes,
from
our doctors and other staff, they were trained up there, and we are expecting that some of the consultants from Korea will come here. You asked me that about 100 crore of taka is going abroad. So this hospital will prevent those patients not to go abroad. This patient will be treated here. If you can think that during Corona, no patient was outside this country, as because they could not go. Who have given their treatment? All the specialists of Bangladesh. So we are competent enough. But some of the people who sometimes visit other countries and goes for the treatment. Someone who has much more money, they don't buy any products from Bangladesh for marriage. They are going to Thailand or Singapore. I will not be able to stop them.
I do have a few questions supplementing to this point. Like after opening up the passage of super specialized hospital under Bangabandhu Sheikh
Mujib
Medical University, would it be capable enough to give special service to the people, the whole number who will be willing to come here,
yes.
or that would be then another pressure, so
yes.
that would it be the situation that next phase would be liking to open up some other affiliated institution?
Yes. You all know that all the postgraduate institutes or all the medical colleges where there is the course of postgraduation, they are affiliated by my institute. Like NIGDU, there is the kidney department.
NIGDU stands for?
National Institute of Kidney Diseases and Urology.
Oh, located in the
NIGDU. Yeah, in 𝗕𝗵𝗿𝗂𝗃𝗃.
Okay.
There is also transplant. Bangabandhu 𝗃𝗃 Medical University has renal transplant, cadaveric transplant, and you all know the liver transplant is going on.
What about the rate of success?
The rate of success, I think today, up to my knowledge, the liver transplant was done about 6. Out of these, 80% failed. But during my tenure, about one liver transplant I have performed last year, the patient is all right. Cadaveric transplant, 2 kidney and 2 cornea patient was given, they are now all right. And every day, last 15th August, during the morning day, with the respect of our father of the nation, there was kidney transplant there in super specialty. We have performed another pediatric kidney transplant to the baby by her mother. They are all right. So I think the success rate is now 80% positive.
Professor, isn't it that, relating to the surgery, there is 2 parts. One is, having rate of success during the surgery, and the crucial factor is, post-surgery management.
Post-surgery management.
What if the post-surgery management, the quality management? There is, say from experts that in Bangladesh, there are, some institutions or some faculty, they do have, weaknesses of managing the post-surgery.
But this in our hospital, I think we are strong enough for the post-operative management, and the patients are all right. During surgery and post-operative, both are strong enough, other than any other institute of this country.
So you do have very confident message to our people.
Yes, I am giving the message to the people that you should not try to go abroad for your treatment. Come here. If we are failed, as because a lot of liver transplant I will not be able to perform, but every week I can have the renal transplant. I will have the robot. If I bring this robotic surgery, the robotic surgery can be done much more transplant and other surgery every day. 𝗕𝗵𝗶𝗵𝗂𝗍 or breast surgery or hair implant or the bone marrow transplant, all these things will be here.
So multiple
people are going, yes, multiple services will be there as the students, as the patients are going abroad for all this purpose, even
so
infertility.
Mr. Vice Chancellor, you have said it about the quality services or training programs for the doctors. Then another crucial elements, a crucial area is, nurses, their services. What are their quality?
I think
training
the
programs
quality of
to improve them.
We have already started the BSc and MSc nursing here. You all know that there is the only diploma nursing in Bangladesh. But for the improvement of the quality of the nursing, Bangabandhu Sheikh Mujib Medical University has already started BSc course, MSc course. And the students who are passing out from BSc, they are becoming they are getting the job here. So these quality nurses are here. So the service of these nurses are, I think, not bad, and this is quality. They have already taken training in Korea, and I hope some of the Korean people will come, and they will also give at least some training.
So you're talking about
staying
the
here,
specialized.
super specialized.
And even what is the regular one?
The regular one, it is also.
Okay.
If you can visit to any department, I hope your cleanliness, the behavior of the nurses with the patients, doctor-patient relationship, it is better than any of the institute in this country. And because I am always with them, I am advising them to work, and they are very much obedient. I hope all the patients who are coming here, by seeing the cleanliness, by seeing their activities, as well as their behavior, even the nurses are giving drug to the patient. They are maintaining their temperature and the pulse chart. Also, they are always, I have given the advice that just when you will go to the patient, please try to laugh.
May I ask you another question
relating
to this? Let's say if any person having treatment here, or the person's attendant, if anyone felt sort of not being served properly, then do they have access to you?
Yes. Everyone can come
your
to
door.
Yes, I have some complaint box here, and if anyone wants to come here, outside.
Okay.
But if anyone wants to see me, if they come by 8 to 8:30, they can directly talk to me.
30 minutes,
yes.
Morning time, 8 to 8:30.
Morning, 8 to 8:30, and they can write down anything to me, which will be, at least I will examine and I will take action against those people who are doing not good. And you see, not only the service, this university is also for the teaching. So teachers are giving every day, morning session, teaching and learning by doing the residential course. It is also can-made, like Canada, international standard, post-graduation. And this is the only university where only if you don't work, you will not learn. So, learning by doing, this is the course.
Great.
So, they are the competent specialists. Again, every day, every year, 1,000 research work is going on here. 1,000 every year. So, I think resident course from 2010, it is being continued. I hope in 13,000 research have been done during that period in the year 2023. So, some of the research work like that, the French fry has maximum salt, we should reduce the salt. Fiji drink, which is being used or taken by the young people, kidney may be damaged. Some of the COVID, where there is the depression, where the insomnia, and how we can combat it. Again, how we can combat the dengue, and in the long COVID, what are the other problems. This type of research work is going on, and even dry eye during COVID, it has been increased. If there is a deficiency of vitamin D, diabetic retinopathy and corona is being increased. All types of research work is also going on.
Honourable Vice Chancellor, these research definitely would give a better service to our nation. And then, is there any master planning for, combating number one, if there is any upcoming situation like COVID? This is one no. Would you please first?
Okay, in my university, I have already made 2 or 3 committees. One for COVID, I had the collaboration with China. We would make the vaccine, and still mRNA vaccine we tried. And you all know about the 𝗕𝗵𝗆𝗵𝗂. This vaccine would be clinically trialed here. In 𝗕𝗵𝗆, there are about 12 vaccines will be made. We have already proposed.
Could you please explain a little bit more for our people?
Yes, 𝗕𝗵𝗆 is another company. It is the Essential Drug Company Limited. All the drugs are being based in Gopaljganj and Dhaka.
In country.
Dhaka, and in this country there is the 8 centers like Bogura, Pabna, Kustia, Gopalganj, Khulna, in this way. And I have made one collaboration with Essential Drug Company Limited, that if you can make the drugs, if you can make the vaccines, we will work together, and after getting the vaccine, clinical trial will be here. And again, we have made another committee for making dengue vaccine, as because we have already started in the other countries like 𝗕𝗵𝗆𝗃, 𝗕𝗏, IHN, and another one, NHT in Thailand.
That's interesting. Just I wanted to shift to this sector in dengue. As we all know, it is very alarming in the capital, as well as it is also spreading across the country. And there is a report, 𝗕𝗵𝗆, it said that October and November month would be very crucial for dengue. Then what was the planning to combat?
Yesterday I had a workshop here, that how we can mitigate this dengue. Maybe community approach, maybe everyone should work together, like school, college, university, for awareness. And the drugs and the pesticide, which is given, whether it is active or not, we have to take the sample, and there will be some research work. Again, we have already made that the protection by missile, as well as the water, stagnant water should be removed, and larvicide should be given by those pesticides that should work much more and kill the kill all the mosquitoes or larvae. So in this way we can also at least combat this dengue. And if the people are aware of, if everyone just remove their stagnant water, they will be able to be successful one.
Thank you so much. Actually, we as commoners, we have a common understanding that having a better medical service means it has 4 components. One, sure, doctors, and then nurses service, and then quality medicine, and over the management.
Yes.
And what about the medicine issues?
Okay, in my university, I think the medicine which is being given, it is the quality, and because the essential drug is also given, and the drugs which are being supplied by our amount, that drugs are also established drugs from the quality pharmaceutical company. And I hope the drugs which are being given to the patient, they are they are being cured and they are going abroad.
How to scan in between, genuine drugs and there is adulterated many fake drugs that they are in the old town. If
Yes, yes.
it's criminals are acting. What would be the line of actions from your side? Means doctors, the management side, from the government health sector side, those who are the policymakers. It's very crucial to put a checkpoint.
In our hospital, we have made some pharmacies. The drugs which are being given by the pharmaceutical company, all those are tested. But drug testing laboratory should be there. As you have mentioned, that some of the people, they are giving the fake drugs and criminal works they are going on. So if we can make the drug testing laboratory.
What's your suggestion to the people, common people? How
they should not buy any drugs.
Verify.
Yes, our Honourable Prime Minister has given the decision that without the prescription of a registered doctor, antibiotic, steroid, that should not be bought from any pharmacy. So if any pharmacy holder always sell this type of drugs, he will be punished. Number two, the people of the country, general people, they should not buy any drug without the registered doctor's prescription. And because if anyone take any analgesic or paracetamol like drug, other than paracetamol in dengue, he will be this will be dangerous. Again, any antibiotic if you can buy and you take on your own, there will be the resistance, and in future you will not be able to survive without with taking any other antibiotic if it is antibiotic resistant. So the people should be aware of, they should consult our drugs and their doctors about the drugs, and they will not buy their drugs from any pharmacy, their own on their own interest.
I want to ask you a question. Maybe it's a bit of sensitive, like to get success in every sector, money matters. So to get success in the medical sector, money matters. So are you satisfied with the national budget allocated to this health sector?
I was the leader of Bangladesh Medical Association and the Secretary General of BM. We have already maintained that about 10% of the total budget should be in health sector, but not yet it is being maintained. So I want to have this achievement 10% as early as possible, and the people who are working in this sector, they should be honest enough, they should work hard, and the patients who are coming to them, they should have good behavior, and the budgetary allocation that should be increased until it is being increased. Proper utilization can help some of the patients for their better treatment.
From the national diameter, I want to come back again to this particular institution, Bangabandhu Sheikh Mujib Medical University. Probably our people, country people, are very much interested to know what's the size of doctors and size of nurses. Again, for this Bangabandhu Sheikh Mujib Medical University and for the super specialized.
In the country, there should be 1:2:3. If there is one doctor, there should be 2 nurses and 3 technologists. But in this university, we are trying to maintain, but we are not yet achieved that one. So now it is 1:1:1. In this way, it is going on. But in the government sector, it is much less.
Do you have any projectional map to
yes,
achieve it?
I have the projectional map like that. In future, I hope there should be much more nursing institute, there should be technology institute, and the doctors who are coming up, they should be trained up for better treatment facilities in our country. And if we can have the 10 years or 20 years map, I think 1:2:3 can be achieved in future, according to World Health Organization.
Would you please make comments on, nursing institute, training institutions, those who are grown by the private initiatives, about the quality? Do you have any observation?
I have some observation.
Because you are one of the central leader of the sector.
Yeah, and also I am also one of the board member and advisory board member.
Yeah, that's why I said you are one of the central leader.
So I think the quality of the private nursing institute is not up to the mark. So I think government will take care of this, and the quality, where there is no quality, that should be stopped, and new quality nursing institute, medical assistant training school, or the technology institute that should be established with the quality. And I hope if we can make this quality, the patient doctors and patient nurse or patient technologist relationship, that will be improved, and health sector will be benefited, and the patient will stay in our country. They will not go abroad for any treatment. They will have some confidence on us.
Mr. Vice Chancellor, relating to your sermon, please put your final remarks to encourage our country people, to encourage the patients of our country to get back their confidence, to get treatment, particularly with the critical condition in our country.
Thank you very much. You all know that our Honourable Prime Minister, who has given a lot of confidence on all sectors. There is the development of our all sectors like education, health, the improvement of our movement like 𝗕𝗏𝗵𝗿𝗵𝗂, metro rail, 𝗕𝗏𝗴𝗯𝗠 tunnel, the 𝗨𝗵𝗵𝗍𝗏. In this way, our country is being developed. In health sector, we are coming up. The people are getting lot of services, including some amount to even widows, some freedom fighters, and also we have seen that the landless as well as the homeless people are getting lot of the houses. Lastly, I have seen that our Honourable Prime Minister has given 460 mosques to different upazilas. I think in the health sector, I will request all of you that in our country there are a lot of facilities, but you are not searching where the facility is there. In Bangabandhu Sheikh Mujib Medical University, we have already achieved this confidence. The patients are coming here, all types of treatment, all the surgeries in general surgery, breast surgery, ENT surgery, eye surgery, neurosurgery, everything is going on, orthopedic surgery, arthroscopy, and lastly I will say liver transplant, kidney transplant, cadaveric transplant, and all these things are going on in our country. You are not needed of going abroad. I hope in future if I bring the robotic surgery, that will also give us another horizon, and I hope all the patients living in this country come here in Bangabandhu Sheikh Mujib Medical University. I hope you will be satisfied for your treatment and you will not go abroad. This is my appeal to you. You keep your amount in for this country, but don't give it to other countries, which will be very much disaster for the country.
Mr. Vice Chancellor, thank you very much for giving the very vivid picture in the medical sector and in the national frame, as well as the picture from your leadership on the Sheikh Mujib Medical University, as well as under this structure, super specialized hospital. I hope our country people will be largely benefited out of your statement. Dear viewers, for a long we talked to the Vice Chancellor of Bangabandhu Sheikh Mujib Medical University, and through his statement it is very clear that in our country there is now strong infrastructure to receive medical treatment, even for many critical diseases, even for very complicated surgery. So we are hope and looking forward future, and of course Bangladesh is moving ahead under the leadership of our Honourable Prime Minister Sheikh Hasina, and to that extent, as the Vice Chancellor assured each and every citizen of this country, we take a note and we go back. Thank you very much, stay with us, and I'm thanking from the platform of Press Express. Stay connected with the Press Express. Thank you.